Ramona, why don't you introduce yourself? Tell us a little bit about your story and your work right now, and then let's talk some about trauma and resilience among nurses.
Sure. Hi, everyone. My name is Ramona Baucham. I have been a nurse, graduated from ACU back in 1996. So a little over 25 years I've been practicing nursing here in the Dallas-Fort Worth area at several hospitals. I spent the majority of my time as a nurse at Baylor Scott and White Health at various facilities, and have most recently relocated to UT Southwestern to be their nurse scientist and magnet program director.
Are you seeing a large number of nurses say, I can't do this anymore?
I would say there's a larger number than we as a profession would like to see. We always sort of anticipated, we've been hearing pretty much since I left school that there was an anticipated nursing shortage that was going to be ongoing during this time. What the pandemic has done has intensified it and accelerated it. So you see in various pockets of our profession, nurses either relocating, maybe taking assignments that are not hospital-based, more travel assignments. That is a really huge draw for nurses. Also, you see nurses who are leaving the profession. You have some people who are retiring. Some were ready to retire anyway, and some are retiring early. You have some people who are leaving the profession altogether, which is never what we want for people who've invested so much of their time to become a nurse. We have seen a fair share of people who have lived through these experiences and for many reasons have decided that they're not going to stay. And so, but on the other side of that, we have seen just record numbers of people applying for nursing schools and trying to become a part of the profession. So it's sort of this sandwich effect that's happening. The short term is there is a tremendous emotional, physical, and mental toll that has been taken or uptake sort of absorbed by the nurses. Of course, anyone who comes to this profession realizes that it's a giving profession. It's a profession of empathy. You go into it knowing that you are going to give a lot of yourself emotionally, physically, spiritually. And I think you expect that. I think what sort of happened is with every new surge, so you get that initial surge and people were not quite sure what COVID was and how dangerous it was going to be and what the potential impacts to their own personal health and taking it home to their family and being able to take care of their patients. There was a lot of adjustments that hospital staff and nurses in particular had to make in those early days of the pandemic. As it sort of wore on, I think everybody sort of settled into this, this is what we're trying to do. We're trying to make it work. The patients were very sick many times who came to the hospital with a COVID diagnosis, but you still had a really large number of patients who still needed care and they didn't have COVID. So you had to sort of manage both experiences with the extra protocols and precautions. And there was a lot of attention, right? The community was very supportive. There were meals coming to the hospital and people were really engaged in trying to make sure that the frontline staff really felt, love and support. As it sort of wore on, things changed, particularly with the vaccine coming into play and some of the different positions and things that people started to develop about hand hygiene and masks and social distancing and vaccines. And so as much as we can as nurses, we try to educate and we try to share our knowledge and expertise with the public at large. And so I think nurses felt a tremendous responsibility to really share what they felt like was scientifically sound and could keep patients and families and communities safe. But some of that, of course, was met with some resistance, which I think also had its own sort of emotional impact on the nursing staff. And then you sort of fast forward to these additional resurgences that we've had and are continuing, and people have started to turn back to their lives and want to move on. And that's to be expected. We know we can't be in emergency mode forever. But I think what you're starting to see for the people working in the hospital is that we're still taking care of patients who are very, very sick. We're still trying to manage as best we can the protocols and the changes that are ongoing, either from our federal agencies or state agencies, any legislative body, CDC, whoever's giving us guidance. We are still trying to make sure that we are taking care of our patients the best we can in the most safe way that's going to lead to the best outcomes. And so that still requires a extensive physical, emotional, and mental commitment from a staff who's been really sort of in the trenches for the last several years and really hasn't seen a break from that high level of intensity.
Yeah, the intensity, I think, that's a good word, and I want to express apologies, not the right word, but certainly concern for the way in which our medical professionals have been caught in the middle of the politics and the opinions and the rulings and the mixed messages, if you will. Certainly, for the disinformation has been a problem as well.
There is quite a bit of things that nurses are experiencing. There's a high level of combativeness and violence that wasn't really a part of our landscape as much. But we've always had incidents of workplace violence, but it really has very much accelerated, particularly in the last couple of years. With people, I had one nurse recount to me that they were experiencing so much death in their unit, and they were taking care of patients, and it seemed like when they would, and this was when the precautions were that families couldn't come, they would be coding the person. So doing CPR, actively involved in calling the family and trying to find out what their wishes were. And, there were many people who still believed that COVID was a hoax and that the medical staff had somehow done something wrong that caused these life-threatening emergencies to happen to their patients, their family members. So it was really disheartening for the staff, who really felt like they were doing everything they could to keep their patients safe and get them well. But everybody didn't get well. It's really sort of like the perfect storm for having a workforce that is really susceptible to the worst kinds of burnout that are possible. There's been so many tremendous examples of that. And I think you just couldn't find a more dedicated workforce. Of course, I'm a nurse, so I'm sort of biased about that, I'm sure. But every day I see people coming in or leaving from their shift. They still have a smile. They still have kindness to show their patients and to each other. They're working together, really just trying to make every situation work out. I think even with the nurses, both my parents at the very beginning of the pandemic got COVID, and they were admitted to the hospital where I was previously a supervisor, and they were patients on a floor where I worked. And the nurses were so dedicated in calling us every day. That was during a time when families couldn't visit. And even though I was an employee, I couldn't come and see my mom and dad, who were both sick at the same time. And at that time, there weren't even 100 people in Dallas County who had been diagnosed with COVID yet. So it was very early on. And they did all the things that you would think you would want done if you couldn't be there. They talked to them, and they called, and they would help them call us so that they could hear our voice. And they put them in rooms side by side with a window partition so that they could see each other. My parents had been married almost 60 years. Now, of course, my dad made it home, but my mom unfortunately did not. But it was just seeing in those early days how dedicated the nurses were, even though I knew they were putting themselves at risk. We didn't know much about COVID then, but they stood together, hand in hand, just trying to figure it out and keep us posted. There were all sorts of examples that I watched with my coworkers, people really taking care of patients dozens and sometimes hundreds of days, making sure that they could do little things like get sunlight, or when they got well enough, they would roll them down to the courtyard where they could get a little sun on their skin, or they would somehow get their favorite snack to them. And I really think that's what sort of supported the nurses in being resilient, when they could find those moments of hope,
Mm.
that sort of carried them through all of the uncertainty and the traumatic things that were happening. They found those little puzzle pieces of teamwork and hope, and really committing yourself to a higher cause. We need a little help when we can get it. And so a lot of nurses ask the public to do their part too, wear masks, hand hygiene, social
Mm.
distance when you can, try to do what you could to stop the spread. And that also helped release some of the burden of the full impact of what was happening. But there's always more we can do. So just there's so many really, really great stories of nurses who just went above and beyond, setting up vaccine clinics. And I know of one nurse who, when the schools were starting to open, because we knew it was important for kids to get back to school, she prepared a whole education plan and went and talked to the students about hand hygiene and mask wearing and how to keep themselves safe at school, so that they didn't get sick or they didn't take anything back home to their parents or their grandparents.
Mm.
So she went back to her hometown and taught fourth grade classes just about that, because she was invested in making sure that people could stay safe. So I think when it comes to resilience, it helps you to kind of get back to the things you love and the things that you know are important.
That's beautiful.
I think also there's been a lot of focus on again, connecting, whether that's self-care, work-life balance, making sure that you are finding the spiritual support you need, the mental support you need. There's been a lot of communication about support groups and reaching out to get personal counseling, or whatever it takes. I think people are more aware that you can't just grin and bear it or tough it out these days. You really have to communicate about the things that you're experiencing and find people who can help guide you through that.